Since the Bronze Age, the advance of technology in times of war and peace has changed the lives of people forever. Metal fragments injure human beings in every society on Earth. As wars become more massive and technology terrifying, the injuries are more numerous and more complex. Removal of iron objects from human flesh and bone has always been one of the greatest medical challenges. Doctors often perform complicated surgeries, sometimes crippling their patients. Aside from the expense, the surgeries usually resulted in extensive scar tissue. In 1992, a Yugoslav doctor got a brilliant idea. Why not use the magnets to extract the metal instead of performing complicated operations? In the last 10 years, over 30 international awards were presented to Dr. Mandić. She also treats several conditions with the use of magnets: arthritis, osteoporosis, blood clots, and other ailments. Welcome to the world of magnetic therapy. Belgrade, Yugoslavia. The capital of a country which has been shrunk to a third of its size. 250,000 people died in a recent civil war. After a decade of political struggle,
Srbija je krenula!
Economic sanctions, war in Kosovo, and the NATO military intervention, the country is slowly returning to its previous way of life. Throughout this time, Dr. Mandić has been healing people while perfecting her innovative method. Although she has her MD in Western medicine, Dr. Mandić has been interested in holistic medicine since the mid-70s.
As Western medicine diverged from time-tested techniques into modern technology, bringing innovations to humanity, it at the same time ignored ancient methods that work for many illnesses and keep patients happy.
Western medicine has achieved only limited success in the broad spectrum of human ailments. In the last 2 decades, people throughout the world have turned to ancient medical procedures.
At present, we have the opportunity to combine what works from ages past with modern technology and thus create a blending of ancient and modern treatments.
In the early cultures of China, India, and Christian Europe, doctors put great emphasis on the use of subtle energies.
The energies I employ are subtle energies that change physical and chemical conditions in the body with the least amount of harm.
Aware of the importance of subtle energies, these doctors applied them in the standardized therapies.
The subtle energies I am speaking of are colors, sound, sense of smell, and magnetic energy.
We all live in the tremendous magnetic field called the Earth. The magnetic energy enables important bodily processes.
Our planet is a very big but weak magnet. The evolution of human beings took place in this large magnetic field. Therefore, people and all living things depend on this magnetic energy to grow and reproduce.
It is a constant process in which the magnetic energy turns into biophysical energy. Can we improve someone's health by controlling the flow of magnetic energy? 1992. Thousands of injured people from the war fields of Bosnia and Croatia were sent to Belgrade for medical treatment. Since anesthetics were in short supply, Dr. Mandic started using magnets to ease their pain.
Because these patients were already suffering pain from these injuries, I did not use acupuncture needles, which would increase their pain. Instead, I employed magnets.
As a certified acupuncturist, both an instructor and practitioner, Dr. Mandic eased the pain for many war victims. In the last 35 years, magnets have been used in acupuncture to stimulate the designated areas. A 17-year-old patient from Sarajevo was wounded by a shotgun. Although he had been operated 6 times, several pieces of lead still remained in his shoulder. To treat his pain, Dr. Mandic placed magnets on the injured area. To her surprise, the pieces of lead came to the surface of the skin in less than a week. A new method was born.
This discovery was a vision to me. I started to search for the optimum relationship between the shape and strength of the magnets I was using and the embedded objects I wished to remove.
During the recent war in Kosovo, this young man was wounded by a hand grenade. He received multiple injuries on his chest and arms. 2 pieces of shrapnel were surgically removed from his temple. Several weeks later, the first groups of magnets were placed above the remaining shrapnel. In this case, the placing of the magnets was relatively simple. All of the pieces of shrapnel remained less than 2 inches from the surface of the skin. No vital organs were damaged. On his left arm, the pieces of iron rose to the surface. At this point, they are visible. Several pieces of shrapnel in the right arm are embedded in the flesh. More time is needed to pull them to the surface. Slowly but surely, the magnets are doing their job. After disinfecting the wounds, Dr. Mandic replaces the magnets and wraps them with the new bandage. Frequently, this painless procedure does not interfere with the patient's normal lifestyle. On the contrary, typical medical treatment requires the patient to remain hospitalized for at least several days. In a couple of weeks, his body will be free of all grenade fragments. Before and during the siege of Sarajevo, this woman lived in a predominantly Muslim section of the city. After hiding for 2 months in her apartment, she decided to escape to the Serbian area. She made it, but she paid a dear price. Several pieces of shrapnel and a bullet were lodged near her spinal cord.
The enemy opened fire with all the weaponry they had. We were all hit. There were 37 of us on the truck. Some were killed, others were severely injured.
7 painful years later, the patient is seen by Dr. Mandić. Several doctors refused to operate on her. Even a slight surgical complication could lead to permanent paralysis. The X-rays showed the approximate position of the objects. The Earth's gravitation force pulls the object down toward the lower back. Since the area is dense with nerves, their sliding further downward would complicate her condition. Due to the size of the embedded objects, Dr. Mandić employed a more powerful magnetic device. It is critical to move the objects away from the spinal cord in order to safely operate. In addition, the anatomical maps are often used to precisely guide the iron objects. Before placing the magnets, it is important to manually determine the position of the bullet. After placing the magnetic device for the bullet, Dr. Mandić locates the pieces of shrapnel. Individual magnets are placed above the remaining pieces of shrapnel. Smaller magnets are usually used for smaller objects. If the magnets are too powerful, the objects could injure the body internally. 2 more magnets are placed as an anti-stress measure at acupuncture points, and 1 more to ease the rheumatic pain in her wrist. But how does the human body respond to this treatment? Is the tissue damaged?
The path the object takes does not have to be straight. It is often crooked.
Surprisingly, the object chooses the least harmful path. It circumvates the vital organs around the blood vessels and through the muscle tissue slowly, not injuring the patient.
In the past, magnets had been used to remove small pieces of metal from ocular wounds.
In the 1950s and the 1960s, some doctors practiced removing objects from the eye with large, powerful magnets. Often, the results were disastrous.
Sometimes this abrupt treatment caused tearing of tissue requiring stitches.
The key to Dr. Mandić's method is to determine the path of least resistance. Sometimes it takes months for an object to go around certain organs in the body. Slower is safer. However, the efficiency counts the most.
I have treated over 600 patients who had experienced war and work-related injuries. None of them experienced internal bleeding or punctured blood vessels.
This case was one of the most difficult of her career. A mortar shell exploded a few feet behind this man. Over 300 pieces of shrapnel pierced his body.
When I was delivered to the field hospital in a nearby village, the doctor said if I managed to survive for 2 hours, it would be a miracle.
Most of the shell fragments were lodged in his back, causing extensive bleeding and mutilation. Many pieces of shrapnel penetrated into the chest cavity. Some of them damaged his left lung. Miraculously, his spinal cord was not damaged. His serious head injury was of great concern. Prior to his first session with Dr. Mandić, the patient was suffering from blurred vision, headaches, and indiscernible speech. Although he had undergone extensive surgery, many pieces of shrapnel remained embedded in his head. Additionally, 2 bone fragments were lodged in his brain. The neurosurgeons decided to leave the fragments intact. Since the shell fragments were dispersed over the upper torso, the task was to pull them out to a central area. The second step was to bring them to the surface and remove them from the body. This complicated task required the use of her second patented invention, the MADU.
The MADU is a unipolar strip of magnets. It can be adjusted to each individual specific condition.
The MADU is an elastic strip with a precisely arranged sequence of magnets. It is so powerful that it can attract an object 17 inches deep within the human body. This device can be customized to treat each individual case. The MADU is usually comprised of 2, 3, or more levels of magnets. This configuration gives it more strength than her previous invention. Dr. Mandić sees this patient every 5 to 7 weeks. The recent visit confirmed that the objects traveled to the left side, moving in the desired direction. The MADU is once again placed at this location. It is expected that most of the fragments will come out in the next 2 to 4 months. After agreeing with the neurologist, Dr. Mandić decided not to remove any of the fragments from his head. However, he will wear less powerful magnets during his sleep in order to improve his speech, vision, and equilibrium. Although he wears the MADU 24 hours a day, the patient can go to work. His physical disabilities will be significantly reduced. He can have a normal, productive life. While extracting foreign objects from patients, Dr. Mandić began to explore treatments of other diseases. In the course of treatment, she discovered how magnetic energy could be used for many different medical procedures.
In the course of using these magnetic devices, I noticed other positive changes in the human body.
Here, a patient suffering from muscle spasms with a pinched nerve of the lumbar region of the spine is receiving her 7th treatment in a series of 10.
I slipped and fell onto the left part of my body. From that time on, I have experienced severe pain all the way from my lower back down to my toes.
More than a dozen doctors were consulted for solutions. Each diagnosis was different. 18 months later, the pain had become unbearable.
She couldn't walk or sit normally. Her doctors gave her large amounts of painkillers.
Finally, with no treatment strategy in sight, one of the consulting physicians recommended Dr. Mandić. First, a complete treatment procedure was prescribed. She begins with a 10-minute massage. Drawing on her knowledge of acupressure and acupuncture to remove the glycopolysaccharides, also known as acid sugars, she alleviates the pain. Placing 4 suction cups on her lower back, the resulting suction gently realigns the affected tissue. Employing acupuncture, Dr. Mandić triggers a complex chemical process that releases bioelectrical energy. Moksha is then applied. This is an herbal wrap, cylindrical in shape, and attached to an acupuncture needle. As the moksha burns, the pain lessens. The Suntown machine, a standard device in Chinese medical treatments, introduces simultaneous electroacupuncture and electrical stimulation. She adjusts and calibrates the level of electrical current to the needs of each patient. Electromagnetic patches are applied to key locations on the body. These strange instruments work harmoniously to treat the patient. A low-powered ultra-red device increases the flow of oxygen to the muscle tissue. The combined impact of the laser and the magnets eventually decrease the pain and improve the blood flow, causing acid substances to dissolve and the pain to decrease. Though stimulated by other procedures, only the magnets were used throughout the entire treatment. The combined use of holistic and Western medicine reflects the philosophy of Dr. Mandić. The future of Western medicine depends on using the innovations of the present without forgetting what worked in the past. For this patient, the treatment has left her free of pain. In 1941, Mrs. Kovačević joined the Yugoslavian resistance movement. She was captured by the Nazis in 1942 and was sent to the German concentration camps. First, she was shipped to Mauthausen and then to Auschwitz. As a result of her confinement, she has suffered most of her life from crippling arthritis. Additionally, osteoporosis has severely affected her left hip. Since she was unable to walk, family members helped carry her to Dr. Mandić's office. After obtaining additional data, she selects for treatment a Beta 2 and TC6 machines. These devices provide electrical stimulation of acupuncture points and activate their meridians. Several electrical patches are placed in strategic locations on the skin. These will decrease the swelling and increase blood circulation. Massage is employed with the use of several types of medical oils. Aromatherapy is then applied to the neck area. A magnet is then placed on the neck. The purpose is to raise the temperature of the affected area by 1/10 of a degree Celsius. This slight increase in temperature provides better metabolism, increases the blood flow, and restores the life of the tissue. A second magnet is attached to her left arm at the meeting point where several meridians converge. This improves the function of the heart and lungs. After a brief massage, a magnet is placed on each knee. The technical name from Chinese practitioners is called tiger eye positioning. It reduces the pain, helps to regenerate cartilage, and allows for increased mobility. Next, a magnetic device composed of 12 magnets is prepared for the right hip. The purpose is to stimulate the area around her hip affected by osteoporosis.
Due to my illness, the bones in my hip have become riddled with holes. The doctor said she could use magnets to move calcium from other areas of my body.
Since iron magnets can manipulate calcium, Dr. Mandić attaches her equipment to the affected hip area. Next, she concentrates on the degenerative arthritic condition affecting the patient's finger. Since Western medical treatment rarely succeeds in reducing this type of arthritic swellings, the treatment employed here is groundbreaking. Small magnets are placed on each finger. This method takes time, but the results are astonishing. 67% of the patients suffering from this type of arthritis experience sufficient increase in dexterity and a considerable relief from their pain. Results in this case are immediate. After all her sufferings, she can finally experience a better, easier life. Nikolina, an 11-year-old girl, is suffering from synostosis, a deformation of the ankle, which occurs usually in adolescence. The bones of her foot are too tight. Nikolina's mother was upset when she noticed her daughter limping. Her podiatrist recommended delaying treatment until she reached puberty. When Nikolina's mother heard of Dr. Mandić's treatment on TV, she gave her a call. Almost immediately, Dr. Mandić accepted the case and scheduled treatment. X-rays revealed that the patient was suffering from a degenerative joint disease. First, Dr. Mandic applies the Suntown machine to stimulate the affected area with electric energy. Next, a simple therapeutic exercise was prescribed. Then, Dr. Mandic prepares her magnetic device for Nikolina. "11 level 1 magnets are placed on Nikolina's ankle. For the next several months, Nikolina will keep these magnets attached to her foot. The magnetic energy stimulates the so-called gap junction information channels in the bone and cartilage cells. This allows the normal growth in tissue and cartilage. Thanks to this treatment, in the autumn of 2000, little Nikolina was able to walk normally. The magnets did their job again. In our world, where profit often outweighs science, even in the field of medicine, inexpensive treatments that usually work are too often discarded as primitive folk cures. But when mainstream drugs and medicines fail to provide relief, such techniques as acupuncture and Dr. Mandic's magnetic therapies open a window into a world of holistic medicine. Dr. Mandic puts ethics before profit in the treatment of her patients. More than 50% of them are treated free of charge. Some of the others pay only for the cost of the materials. In an area of the world like the Balkans, where ethnic hatred abounds, she brings healing to all.